swasa. Mahaswasa, Chinna swasa, Tamaga swasa, Pradamaga swasa, Chudra swasa. There is no dosha. The treatment for Mahaswasa and Chinna swasa is absent, not documented. Not absent, not documented. Swasakara medicine is Vata Kapagara, Ushna, Anulomana, Agnidipana in nature. In the Gandha, Vata Kapagara, Ushna, Anulomana. Mahaswasam is cortical, Chinna swasam is pons, injury medulla, Tamaga swasam is respiratory, Pradamaga swasam is infective, then you have a psychiatric problem, then Chudra swasam is hyperventilation. Cortical, subcortical, respiratory, infective, functional, hyperfunctional. That is how the order is being told. So, practically, liver diseases, you have Kapha liver diseases, Pitta liver diseases, Vata liver diseases, fatty liver, Kapha liver disease. When it becomes hepatitis, Pitta liver disease. When it becomes cirrhosis, Vata liver disease. You need a drug. Kaphagaram Yakrut Visheshanam for Kapha liver disease. You select a drug which is Kaphagara and Yakrut Visheshanam. Can you tell something? Let them tell sir, you know. They are students. Kadugarogini, Pittarasam, Ruksha, Pittashamana, Kapasamana, Sramsanam, Virecham. Okay, but not Kadu. Tippali. Kafagaram, Yakrut Vishesha, Vardhamana Vipali, Buddha Vipali, Kimsuka Patraksharam we add to prevent the metabolic acidosis. We add and we give it goat's milk, not cow's milk because it's alkaline. Then Pitta Samanam Yakrut Vishesha. Which rasa you will select? Tiktam. Tiktam is Shodhana Tiktam and Shamana Tiktam. Padola Kaduroginyadi, Padola Muladi, Vasa Guduchyadi, Shodhana. Guduchi, Bunimbam, Panjanimbam, Shamana. Shodhanam, Uttama Shodhanam, Madhyama Shodhanam, Hina Shodhanam. Padola Moladi, Uttama Shodhanam. Padola Kadurohinyadi, Madhyama Shodhanam. Vasa Guduchyadi, Hina Shodhanam. So, Samana Diktam, the word Diktam in text, when it is coming in the Shodhana concept, we should select Kadugarogini. When it is coming in the Shamana context, we should select Bunimbam. So like this we treat. What happens? Because of Kadurasa, Tiktarasa, Vada will increase. Vada increase should be tackled with Madhurarasa. Madhurarasam Yakrut Vishesha Dravyam is needed. Madhurarasam Yakrut Vishesham Vidaryadi can you tell? No. Vidaryadi is Madhurarasam, not Yakrut Vishesham. Dhanvandanam Madhurarasam, not Yakrut Vishesham. Kshirabala Madhurarasam, not Yakrut Vishesham. Drakshadi Madhurarasam, Yakrut Vishesham. Mridvigadi Madhurarasam, Yakrut Vishesham. So we select Drakshadi and finish the treatment.
Mridviga, Draksha same.
Yoga is different. Yoga one is Madhatiya Prakarana, another one is Ashtanga Jora Prakarana. Yoga is different. Brahmi Drakshadi is another yoga. That is the only Kashaya told for Manologas. As far as Shastra I am telling that.
In Manorogas, no Kashayam is told. Apasmaram, Unmadam, Adatvaginivesam, Grahani Roga, Kashayam is not told. Only Gridam is told. Gridam is Medya. They are not knowing that which is fat soluble alone will cross blood-brain barrier. They were not knowing. They know Medya, Dravya Samanyam, Guna Samanyam, Karma Samanyam, they were knowing.
20 to 25 Gridas in Apasmara Unmada Prakarana. No Kashayas.
Samjasthavara Kashayam is there.
They are not using. Brahmi Drakshadi came in Madhya in 16th century. Vada Vyadi also in Kerala, they start with Kashaya. I asked the great Vaidyas also. In Vada Vyadi there is no Kashaya. No Kashaya. The first Kashayam told in Ayurveda is Bhadradarvadi told in Susruta Akshebara. The second Kashayam is, you hear me, you get the video. Allah will take the video here again and again. While I talk, you will listen to me. If you write note, you will miss. Because I will be shifting from one point to another. So, Sagadanani. Sagadanani is told in Urustamba. Urustamba is not a direct Vadavyadi. Even though it is told in Nanatmada Vadavyadi, you may argue, but it is the Kapanubandha Amayuta Vadavyadi. There only one Kashaya, Kavirasa, Ushna, Diktanubandha, Vadakapara, Srodha Srodhana, Adakaya Visesha. It is there. So today we are thinking 20 cases I have got. Whatever possible. Next slide. Patient care, Padmanabhan, 60-year-old male. Next. Came with swelling in the feet and ankles, edema, abdominal swelling, poor appetite, dry skin, fatigue and weakness, dyspnea, gynecomastia, scrotal swelling. 1 year duration. Usually, cardiac edemas I treat like vata edema, Dasamula I will select, Bragatyadi I will select, Dasamula Airega I will select, Arjuna Kshira Bhagam I select, Stira Mula Kshira Kashayam I will select. Inflammatory edemas or pitta edemas, these type of edemas, chronic or kapha edemas. This is the complaint in which he came. Most of the cirrhosis are not diagnosed during compensated phase. Decompensated phase only we are diagnosed. That is why we make a problem. Alcoholic liver cirrhosis has come down. Alcoholic liver cirrhosis has come down. Other forms of hepatitis C, chronic hepatitis cirrhosis, is also coming down. Fatty liver NASH-induced cirrhosis is increasing. Probably a doctor will see 4 to 5 cases in a year. It's very increasing. Next. No diabetes, no hypertension, no ulcer, no asthma, no known allergies, no allergies. Anemia. Low hemoglobin, low platelet count, low albumin is characteristic feature of liver disease. Bilirubin, you have conjugated and unconjugated. Koshtagadam, Shagagadam. Technically, Pitta will be vitiated, mixed with Rakta, enter into the liver. Liver is Pitta Sthana. Sthaniga dosham, Agandha dosham, Pitta Rakta. Hepatitis A, B, C, D, E. Wilson's disease. Hepatocellular carcinoma. Hemochromatosis and toxin. All Kottagada Kamala Chikisa only. Tiktarasam, Ruksha Vileda.
You may select anything you have in your style and in your place. I tell you one example. When I was with my master, when Wilson's disease came, I was not knowing about Wilson. He called the allopathic doctor and asked, what is this? Picture is jaundice. First we are given Avipati Churnam Virejana, Padola Mudali Kashaya, all these things we are given. Improvement was less. Then at that time we were not using Jimudanasya. Now in Porta Kamala, there is none, Mangasena, we use 8 drops of Jimudanasya, very effective. But it is not effective in obstructive and hemolytic, it is not effective. So he told it is copper deposition in the liver. Copper. Then after a day, my sir told me, bring Rasadharani. I took the book. He asked me to read the copper tamara purifying drugs. It is Rakta Varga, Manjishta, Jadi, Champarati, that is Jabar Kusumam, Kesaram, these Rakta Vargas. Sir told me, if it is capable of purifying copper outside, it should purify copper inside. Then he gave this Rakta Shodhana Kashaya. Then after 1 month, this fellow, Wilson's did not go. He became asymptomatic. Yada Pitte, Tada Brahmande. So, after a few years before, one iron toxicity called hemochromatosis, producing like jaundice, came to me. I told these fellows, my Sishyas, bring the text. What is the Shuddhi Dravya for Lord? The Kregava Mutre Aranade Kulattade. I told you give. Samana Sneyavana, Gomutra Prayo. But against the concept of fundamental principles, there was improvement. So this is an area where we have to vomiting nil, headache nil, fits nil, kidney stone nil, IHD nil, jaundice not known. Next. Habits, no smoking. Smoking is a Vada Pitta Vardhana Hedu. Kadu Pitta Rasam, Kashaya Rasam, Kapagaram, Ojo Haram, Vada Pitta Vardhana, Dada Kshaya Vardhana, Ojo Nasana is equal to cigarette. So cigarette is dangerous. Skin disease, thyroid, piles, vertigo, surgery. No. Next. 101 kilos. Next. Water intake 1 liter per day. Output less than 500 ml per day. Bowel movements regular. Next. Salt restricted. See the reports. Normal. Next. Bilirubin is slightly high. Alkaline phosphatase will be high in obstructive liver disease. Alkaline phosphatase is useful in Shagada Tamala. Programming time, bilirubin increased, albumin is less. This gives you a quick clue. Padola Muladi is there. Padola Kadulovinyadi is there. Vasa Kuduchiadi is there. All are Pittarasa. Why these many yogas? Why these many yogas? This is the case with the cirrhosis liver with hyperproteinemia, hypoalbuminemia, with ascites. Which will you select? You will select Padola Muladi only. Why? Pittarasa, Ruksha Virejana. Padola Kadulovinyadi is also Pittarasam Ruksha Virejana. It should be given for Shatratra Prayogaha, 6 days only. 6 days. What is the Anubanam? Jangala Mamsa Rasam. If you are giving Padola Muladi without this Mamsa Rasam, Padola Muladi is a waste. Mamsa Rasam is protein. Protein is given in hypoalbuminemia. It is a drug for hypoalbuminemia in nephrotic syndrome and liver disease where you treat with Pittarasa, Ruksha Virejana, Tredasoshana. If you are not giving Mamsa Rasana, you select Padola Kadulovinyadi itself. That is why Shastram, Yukti, Anubhavam, three should go hand in hand. Now this is the harmonium here. So you see, OT is greater than PT. In alcoholic cirrhosis it is seen, drug-induced cirrhosis it is seen, NASH it is seen. There is a score, you may be knowing, child book score. Have you heard? Child book score. Bilirubin should be less than 12, less than 2. Albumin should be greater than 3.5. Prothrombin time should be less than 1.8. Then they find out the life expectancy of a cirrhotic patient. Next. Bilirubin slightly high. Indirect is high. 40 is high. Next. Next slide. PT is high. Alkaline phosphatase is very high. Albumin is very low, denoting cirrhotic changes. Next. Next. Gamma GT. Gamma glutamic transpeptidase. GGT. In alcoholic liver disease, it's important. In cirrhosis also, it's important. Next. Now you have the liver shows parenchymal disease in the ultrasound and in the CT scan. Next. There is splenomegaly. Normal size of liver is 16 centimeter, plus or minus 3. Plus or minus 3. The normal size of spleen is 12 centimeter. Greater than 12 is splenomegaly. Splenomegaly. Next. Lymphadenopathy, reactive, no significance. Pleural effusion, mild, no significance. Next. Pancreatic cancer, CA 19/9, negative. Negative. Next. You see the man. Before the treatment, ascites. He went to a hospital, they told a liver transplant. They asked that 3 to 40 lakhs rupees. Pedal edema, ascites, exertion dyspnea. Next. Vada kapha, ekrudodaram, chronic parenchymal liver disease. The thing is, I always tell, Vada, you have rasa, Pitta, you have rasa, Kapha, you have rasa, Vada Pitta, another rasa is there, Pitta Kapha, Pitta Kashayam is there, Vada Kapha, there is no rasa. Shide Shida Pradigaraha Ushneja Ushna Nivaranam. Shidama Vada, Shidama Kapha. Next. Cirrhosis, next. Non fatty liver, NAFLD, NASH, fibrosis, cirrhosis, hepatocellular carcinoma. This is the cycle. Next. Coarse liver. You can see the coarse border of the liver. Next. 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 As there is fluid, I treated like Kari Budam, Kumbhakamala Chikissa, Agnivesha, Amavagana, Tiktarasa, Snigdhara, Kletasoshana, Ruksha, Amavagana, then Mazurarasa Prayoga. So you have to take principle from Swafagna Mutrala Prayogas also. Pittam is Snigdham, Kapam is Snigdham. This is Pitta Spana. So Snigdha Hara Ruksha Virejana is selected. Nobody will select Nimbamrada Erandam or Sugumara Erandam in liver disease. Nobody will select Parola Muladi in a disc disease. Ekritvishesha Aushadam. You have to incorporate Panta Chikissa, Udara Chikissa, Shoka Chikissa. Next. So, Tiktarasam Shokagnam, Punarnava, Kuruchi is selected. Nityameva Vireje. This is Virejana without a Sneha karma. Nadi Snigdam Vireje. durbala rogi balam tasya vidbalam vadabalam rajekshma vidbalam pittabalam agnibalam grahani agnimule balam pumsa kapabalam pragradastu balam sleshma brahme. So here virejanam is the rasayana usana nityameva virejayate. Then madhura rasa pradanya mutra gokshuram shadavari madhura rasam punarnava tikta rasam punarnava swapagnam gokshuram mutra. Madhuram is selected because of tikta kashaya rasa vadavritti will take place. To compensate the vadavritti, madhura rasam is selected. Next. Patient came for review. Abdominal swelling increased. Dyspnea, weight increase, all these things. Next. Then I admitted. Next. I scanned all these things. Hepatitis A, hepatitis B, hepatitis C negative. Next. Next. Autoimmune hepatitis. Rheumatoid arthritis patients, suppose you give or medicines, they may develop jaundice. Once in a way, you get cases like that. It is autoimmune hepatitis. Some of our drugs trigger the autoimmune process. There are three tests for autoimmune hepatitis. Liver, kidney, microsomal antibody, anti-smooth muscle antibody. Next. All these things were negative. Next. Next. ANA. Negative. Next. Next. All cirrhosis patients, we should check alpha fetoprotein, which is the test for liver cancer, hepatoma. So we did it, it is normal, so this fellow did not have liver cancer. Next. Punarnavadi, Dasamurari. Then some two Siddha drugs I started. Manjal Noi Kudini, Karisala. Karisala is Bringaraj. Next. This yoga, I have written Sanskrit name. Manduram, Amrapatram, Brindara, Bhumiyamalagi, Kogilaksham, Jeeravam, Brindara, Padoram, Svedamaricham, Mishreyam, Bilvam, Neeli, Harita Manchari, Apusham, Mandugavarni, Babur. Next. This is the chart, how it improved. Next. Continue the medicine. Abdominal circumference come down after the Shopakna Aushadas and Nityameva Virejayate. When there is esophageal varices and total hypertension, Pippali cannot be given because Kadurasam increases bleeding, he may get hematolysis. So I avoided Pippali. I avoided Gomutra Haridhi. Shiladat, we do not know the quality. Punarnavadi, Pasagudu Chayadi. Next. There is another Siddha drug. Damargam, Kampillagam, Chitrapara, Paribhadram, Kaidarium, Sharavungam, Dandhigam Vayapyam. There are some very good Siddha Aushadas which are not textual, but they are very effective. Follow, urine output increased, ascites reduced considerably. Next. Uric acid, alkaline phosphatase, albumin is low. Next. Microalbumin is very high. Next. The same drugs were given. Then I selected Madhura Rasa. Rasayana, Madhura Rasa Yukte Rasayana. Because of Tikta, Kadu, Kashaya, Prayoga, Draksha Prastam, Kanak Prastam, Sharkara, Artha Dulam Tata. So that we selected. Next. Next. Protram in time became normal. Next. Alpha fetoprotein reduced. It was normal. Next. ESR was high. Hemoglobin was low. Next. Vitamin B12 for all Brahmins, vegetarian community, B12 is less. All Indians, vitamin D3 is less. Have you seen anybody with normal vitamin D? Once you take supplement, it will become normal, again it will become abnormal or low. Next. Amylase was slightly increased. Next. 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 Then Madhurasa Chikitsa only. Drakshadi, Madhuradi, Drakshadi Levyam. Panchamulasya Datri Va. So Panchamulam with Datri Balam as Paniyam. Kaniya Panchamulam cha in Kamala Attangaram it is told. Next. Conclusion. These things came down. Next. Ammonia came down. Next. Next. Hepatorenal syndrome. Next. Next. We will read it after seeing the report. Again, we will come back to this. Next. 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 HbA1c came down. Next. The Agni is corrected. Next. Next. Go to the last. Last. Please, please. Just the X-ray, pleural effusion, gone. The Shopakana Chikitsa is gone. Next, mild one only. Now you see the patient gives NASH with ascites, mild coarsening, mild splenomegaly. Previous one. Remove this. Put that. No free fluid C. No free fluid C. Next. Next. See him. The total cost of the Chikitsa is 15,000 rupees. 15,000 rupees. And next you see him. Go to the previous slide. Go back. Then I will teach you how it happened. Next. So after treating hundreds of cases, these medicines I feel is useful. This is 60% Shastri, 30% Siddha, 10% my experience. Yeranda Patram, Danda Patram is effective in cirrhosis. It brings down OTPT in 7 days. It reduces alkaline phosphatase. In alcoholic liver disease, it is not effective. Small Yeranda tender with the takra is a traditional medicine. I tested, it is effective. Tippari, Sharavunda, Kaduri, Kakamachi, all obstructive liver disease. A cholestatic, obstruction, biliary tumor, these type of cases. Because in Shagagata Kamala only 4 medicines are told. What are they? Trigadu, Kuppada Mansam, Moolagarasam, Dadimadi Swarasam. Only 4 medicines are told. In Shagagata Kamala, Moolava is told. Next. Fatty liver, Kaideria, Virgaraja, Guduchi, Munimba, Takra. Hydria is Kalasaga, sir. Kalasaga, 10 leaves. Very effective. 30 grams with buttermilk for 15 days. Very effective. Next. Antiviral property. The Tamalaki, Bhumi Amalaki, is not having effect in NASH cirrhosis. It is Pitta Rasa, Pitta Samana. Correct. But based on the experience, Bhumyamalaki, this Phyllanthus neruri is having antiviral, viral hepatitis only. It is more effective than NASH hepatitis. These Padola, Bhunimba, Chandana, Guduchi, Neeli, Sharavunga, Daruharidra, they have good effect in reducing viral load in B, not removing the carrier state. A and R doesn't. 1 week treatment we can make it normal. But prevalence of A is coming down in practice because of health awareness, vaccination, carefulness, etc. When I was studying in Ayurveda college, we had 2 bottles in front of Ayurveda college. Bottle jaundice, bottle typhoid. You can select whatever you want. Next. Paribhadra, Madayantika, Yashti Madhu, Punarnava. alcoholic liver cirrhosis in early stage is curable with Ayurveda. It is reversible. In compensated state, it is reversible. But non-alcoholic fatty liver NASH-induced cirrhosis is tough. It is very tough. Next. Hypoproteinemia, Padaulamuradi, Sharabunga, Trayanti. Trayanti is Tiktarasa, Ruksha Virejana, but under Vidradi Chikitsa it is told. I have got only one case, amoebic liver abscess. I gave Trayanti without starting tinidazole or other antibiotics. In the village, he reversed the case. Next. This is my experience. Guna Siddhanta reduces alpha-fetoprotein in cancer. Padava Kadrovinyadi reduces SGPT and OT in 10 days. Drakshadi Rasayana solves in liver cirrhosis maintenance. Vasa Guruchyadi only in hepatocellular, not in obstructive or in hemolytic. It is not effective. Reduces SGPT and SCOT. Bringarajam, even though it is not told in Brihatraya, is in a Kamala Pragarana. Bringarajam is a useful drug after Shodhana. It is a Yakrit Visesha Rasayana which must be utilized. Yellow variety of Bringaraja is better than white variety. Trayanti, obstructive jaundice. Drakshadi Kashayam reduces GTT in alcoholic liver disease. It is understandable. Alcohol is Pitta Vardhana. Draksha is Madhurasa, Pittasma. So we cannot select when the Nidana is Pitta Vardhana, Ushna, Tikshna, Vidagi, Yedu. We cannot select a Tikkarasa Dravya. We have to go for a Vidagi Nasana Ushada. Brihatyadi, portal hypertension. Brihatyadi, Gokshuram is there. It is a potassium supplement diuretic. Gokshuram. It doesn't change the potassium like root diuretics, like furosemide. Next. Now I have compared, standardized these terms. We are not teaching correctly. I thought of standardizing this. After teaching the practical, I tell this is the final conclusion. Kota Sagasrada Kamala, hepatocellular jaundice, hepatoma, viral hepatitis, Wilson's disease, Kostadam, Tikkarasam, Madhurasam, Ruksha. Anything you do. Is it clear? Kostagata Kamala. Pitta goes to the liver. Dosha Dusha Samurthana with Raktam. Pitta Raktam. Asraya Asari Bhavam. Tikkarasam Virejanam. Abhipati Virejanam. Padalamuladi Virejanam. It will come. Then Ruddhavada Kamala. Obstructive jaundice. Tough to manage. Cholecystitis we manage. Obstruction with big stone. If you treat 100 cases, only 10 to 15 cases respond. This is my experience. Your experience may vary. But I have poor experience. Poor cases are coming. When they reduce weight, suddenly also stones are coming. I have not seen, only few males I have seen with gallstone. Only women. SLE is for women like that. I have not seen an SLE in men. Halimaha, hepatic encephalopathy. In Halimaha they say they will lose desire for sex. Hypogonadism due to liver disease. Hypogonadism. Testosterone comes down. Sedentary hypogonadotropic hypogonadism. That's why I put hepatic encephalopathy. Ammonia level increases. Then chronic hepatitis, like C hepatitis, B hepatitis, what we see. Chronic hepatitis. Udaram. All the udaras are portal hypertension, except surgical udaras. Vadodharam is right heart failure. All Pitodharam, peritonitis, ascites, Kaphodharam, cryptogenic ascites, Sannivada udaram, metastatic ascites, all ascites. Yadrut Vidradi, abscess. Pittashmani. The word Pittashmani is not there in the text. Where Ubbusam, gaseousness, pain here. According to a Kai Chikitsa person, this is considered as a Parshva Gulma. Masti Gulma, Navi Gulma, Hridaya Gulma, Parsha Gulma. Gulma, 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 Gulma. This is the 9 segments of anatomical classification of Harrison. Kurvanti Panchavidaha Gulma. One Gulmam here, here, here. Hypogastrium, epigastrium. What is this? Epigastrium, umbilical epigastrium. Right? Hypochondrium, lumbar, iliac. 9 sthanas of Gulma. That is why prostrate is also treated like Gulma according to me. Prostrate is the Kapanavanda Vada Gulma. Kapa Avana in Abana Dushti. Varnadi, Chiravilvari, Chandraprabha. People are the Anuvasam. Prostrate. That's the name. Name has no meaning. Padastila, Tuni, Pratiduni. Some names. Academic purpose it is good. It is needed. Urinary colic, renal colic, all these things. Next. 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 You can put that man's video. Who is talking in Kannada?
Sir, address ಇದೇ ಮನೆಗೆ ಕಳಿಸ್ತಾರೆ ಸರ್, ಇಲ್ಲೇ ಅವರು ಮೀಟ್ ಆಗಿಲ್ಲ. ಇದೇ ಅಡ್ರೆಸ್ ಫೈಲ್.
See my consultation room. See how beautiful it is. Next. So he is telling he is suffering, not like that. He should not advertise. But to improve the confidence of students, they are recovered. So he is told that. I will go to the next one. He is telling he is completely normal, going to the work without transfusion. And liver transplant is avoided. He saved 60 lakhs rupees. That was the